Toddlers thrive in routine and predictability, so any little changes can really affect their mood. In this video, you'll learn about what's normal with your toddler transitions and when you should be concerned. Hello and welcome to the Amaka Nnamani Show, where we're all about preparation over perfection. If this is your first time here, thank you. Remember to like, subscribe, and share with moms in your world. So let's get right into it. So toddler transitions, your daughter or your son is 1-2 years old, and you've had the perfect toddler up until now. And you're thinking, what's going on? My child's biting. My child never bites, or crying uncontrollably, or just not easily consolable, right? So a few things may be the reason for that. There are certain things that usually cause behavior changes in toddlers. One of them is the birth of a new sibling, right? So when that happens, typically your child who's up until now used to being the only child may now begin to have like regressions. So regressions may be like wanting to use a pacifier that you may have already weaned them from, right? It could be regression in toilet training. So a child who was potty trained all of a sudden now again wants to be in their diaper. There might be a little bit of ambivalence, which means that they're excited, but they're also jealous, right? They want to help you with the baby, and then sometimes you may find that they are just not doing things in the most loving way, right? And again, like I said, biting is another one. These are all normal things, right? And so what should you do as a parent? The first thing I usually recommend is validating your child's feelings. So naming it. I understand Johnny, or whatever your baby's name is, or your toddler's name is, validating those feelings. And then having some level of predictability. Toddlers really, really like routines. So having something consistent that you're doing, right? Whether it's having a time in your day where you're reading to your toddler, or this is one I really recommend for my parents, my new parents or second-time parents, is trying to spend quality time, even if it's 10 minutes a day with your toddler. It could be you as the mom, it could be dad, it could be grandma, someone that the child has a good relationship with, right? So that consistency and that routine, at least one thing in their day that's predictable. And then involving them in the process. So instead of, oh, you tried hitting your brother, you tried hitting your sister, validating, but then saying, hey, do you want to help me get the diapers for your baby brother or for your baby sister? Do you want to come sit by mommy while mommy changes your sister's diaper or gives your sissy a bath? Allowing them to be part of that process makes them realize, well, this is not just a new person that's absolutely taking over my life, right? But this person is actually, like, I can love her or I can love him, right? Because these are, again, normal behaviors. And then if you are a mom or dad trying to potty train your child close to the birth of a newborn, I just say don't even do it if you haven't started that process, because the chances are your child is going to regress. So give yourself a good 4 to 6 weeks, and sometimes I say a good 8 weeks, right? Because sometimes your child may be ready, but you need to be ready as a parent, okay? And then importantly, taking time out for yourself as a mom or a dad, because it's a lot having a toddler and a newborn, right? Validating your own feelings and working through that process. Now, if this lasts longer than a month, then you really want to see your pediatrician and talk about other behavioral things that this may be from. Another time when you may see transitions with your toddler is starting daycare, right? So you may have had a baby or a child who's been in a good, same environment with mom or dad or grandma, and now they're starting daycare. They're introduced to a whole new system, a whole new schedule, different people that they've never met. Now, separation anxiety peaks between 12 and 18 months, but even with that, we can still see separation anxiety even longer than this time period, right? So with the start of a new daycare, also you're realizing that at this age, your child is modeling a lot of behavior. So if there are kids in the class who bite or who do certain things, good or bad, chances are your toddler is going to be modeling that behavior, right? So a few things to do, how to help. One, again, validating your child's feelings. Number two, if you're able to visit the new daycare or child care center even before the first day to kind of let them know the environment, meet the teachers, maybe meet some other kids, that really gives them some level of predictability. Right. And then, this is one I see a lot of parents make mistakes on, which is they try to sneak away, right? Like you drop your child off and you're trying to sneak away from, okay, bye. I'm just going to say a quick bye. Yes, the bye should be quick so it's not drawn out. But you really want your child, you want to be present with your child and say, Mommy's going to go now. I love you. You can give kisses. And again, this can be a routine that you have so your child has that level of predictability, right? But I never recommend just kind of sneaking out the back door and saying, oh, he's going now. He's paying attention to the teacher, so I'm just going to sneak out. Don't do that, right? Because your child needs to know that you're present. And while it's a new environment for him or her, they can always trust your love. Right? And then you can even do a countdown before the first day of daycare, right? Or we have 3 days left, 2 days, 1 day. And, you can continue this during the week. And obviously, with the start of a new daycare, making sure you're communicating with your child's daycare teacher or preschool teacher. Now, a lot of schools in the U.S. and even I think all over the world will have these apps that are kind of giving you hourly updates on how your child is doing. But as a parent, I know I did it with my kids. Like when they just started preschool, or daycare, I would just do a check-in with the teacher, like, how's my son doing? How's my daughter doing? And they usually want you to know as a parent that your child is doing okay. So it's okay to reach out as well. And then when you come home, having at least one thing that's consistent in the child's life with regards to routine. One I always recommend is reading. You can't really go wrong with that, right? Is finding a specific time in your day that really works for your family and reading at least 15 to 20 minutes during the day with your child. So other transitions that you may find with your toddler are now, when your child is going from a crib to a bed, right, that's a big transition. Or you're moving, whether it's you're moving down the road to a new house or moving cities or moving countries, a move is a move, right? And that's a big transition in a child's life. Another big one is, parents separating or divorce, or just even a child in foster care. These are all times that that are considered big transitions for children, including potty training. And paying extra attention to those behavioral changes is really important. So again, we've learned about some of these big transitions that can happen. What's normal, like biting can be normal, right? Some anxiety, some jealousy even, especially with the birth of a new child, and just uncertainty, right? And your child may ask some questions if your child is a really verbal one, and please answer those questions. Don't disregard them. I know some of them can be difficult to answer with our children, but it's really important that you address those things. And very importantly, try to find at least one thing in your day that your child can look forward to and say, okay, I know at 7 p.m. we're going to cuddle up in bed and we're going to read a book for 15 or 20 minutes. At least have one thing in your day that's consistent. Now, if these behaviors are lasting longer than 4 to 6 weeks, or if they're becoming aggressive, like you have a child who's hitting their sibling, your newborn sibling, or you're finding that they're just doing things that are concerning to you, please reach out to your pediatrician for additional guidance. I'd like to give a shout out for this video to Adugo, who actually requested for this. So I hope this is helpful for you. I want to hear your comments. How helpful was this? What else do you want to hear about? Put this in the comments. I want to hear them because this is really all about you guys. And I want to make sure that those things are being addressed. So until next time, remember, preparation over perfection. Toodles.